Okay, so Dr. Milovanov graduated in pediatrics from Saratov Medical University in 2003. He received his PhD degree and in 2008 graduated in physics science. He started his career in clinical trial industry from 2007, and as of now, he's providing services for CRO, inpatients recruitment, site management, medical scientific support. His interests are prognosis of patients' recruitment and development approaches to predicting of recruitment. He is the author of more than 50 plus publications. Excellent resume, doctor. That's fantastic.
Thank you for introduction of my person. Sorry for blurring on screen. So I tried to put a background to my video. And, yeah, sorry. Also, didn't manage it. Okay, so I will now present my presentation. Moment, I will open it. Sorry. Moment. Open it up. And okay, so preliminary short introduction before my presentation is opening up. So I would like to introduce some findings which done by me based on the publications observations on some particular topics. And so now I'm opened my presentation and will show it. Okay. And did you see my presentation?
Not yet. No, not yet. There you go. Now it's on. Very good.
Okay, good. So this is again with regard to big industry, which now is on. It is like a cutting edge of the science, and this is for clinical trials or clinical trials industry. And I would like to observe some, from my point of view, from my perspective, is two important part of any clinical trials is enrollment and retention. So, and factors which are influencing to these processes. So, enrollment of patients in clinical trials, it is important part of any clinical trial. And fail in enrollment up to consists up to 86 of clinical trial, and this trial is unsuccessful. Therefore, and moreover, after the patient randomized to the trial, the following, keeping them active in study and then follow-up period, also the challenge, and being called retention of the patients, and fail in this period, also will lead to the fail of the trial, and fail in the retention period consists up to 15% of the trial. Factors influencing to the recruitment and retention is diverse and difficult to estimate due to highly variable. And some authors, like Dr. Fogel, found more than 30 factors influencing to recruitment, and much of them can ruin the trials fully due to fail of recruitment. Other author, like Ms. Dr. Rutger, found more than 30 factors acting differently to recruitment. Also, author seeks the way to facilitate the enrollment. And in order to facilitate the enrollment and retention, based on studied factors and barriers, some authors had grouped these factors to 3 ones to develop this strategy: trial design, protocol, and protocol development, trial feasibility and site selection, and third group is communication. While other authors, like Dr. Kaur, had grouped these factors to 6 groups: trial, site, patient, clinical team, information and consent, and study team. In order to observe the already rich data based on the publications and made full picture of the knowledge of the factors. It was done a review of the randomly found publication with the or relevant to the topic of enrollment and retention in clinical trials as a barrier and the factors influencing to this process. All of found data was grouped in factors and barriers and discussed shortly. So what was found? So the results: targeted recruitment of patients is the main factor in the success of clinical trials, and failure in recruitment is at least 50% of unsuccessful clinical trials of second and third phases. This is phases already pre-marketing phases, why it is important. And failing in the third phases of clinical trials is fail of whole of the study. The recruitment period takes up to 30% of the study time, and the retention or to keep patient in trials in order to reach the study power and reply to the investigator's question is also a very hard task, which require much time and other resources. And the table below is presented factors suggested by authors, which are influencing to ruin of whole of the study. This is I took it from Dr. Fogel. Anyway, I also is somehow to adjust it by myself. So it is factors: failing to demonstrate safety, because it is definitely the aim for any of clinical trials. Failing to demonstrate efficacy, financial impact, eligibility criteria, patient recruitment, respecting to the patient's concerns, additional costs associated with recruitment, pure recruitment, dropouts, underpowered trials, considering the patient's financial burden, employing quantitative measures, patient time investment. Then, after reviewing of the literature on topic of influencing to exactly recruitment and retention, it was also found. There is a table which I titled "Deriving the Factors Affecting Recruitment from Facilitators and from Barriers Described in the Literature." So there is, as mentioned above, the origination is going on different levels, for example, on patient levels, it is a barrier like below, like additional demands of randomized control trials on the patients, additional procedures, additional appointments, time pressures, venipuncture, inpatient hospital stays, discomfort from medical procedures, length of study, worry about experimentation, uncomfortable procedures, travel and travel costs, extra costs, patient preference for particular treatment. Also, patients not wanting to change medication, not to take placebo, not to take experimental medication, not to take any medication, patient request for a specific intervention. Worry on the clinician's level, it is worry about uncertainty. Efficacy of treatment on offer is unproven. Distrust of hospital on medicine, fear of unknown, concerns about information and consent. Amount of information provided to research participants, wording of information, complexity of information provided, different forms of information presentation, written, verbal, or video, limited reading skills, and English not being the primary language, clinicians' experience, difficulty in giving information, and many, many others. Also, time constraints, time pressure, staffing, training, lack of trained staff, also some barriers related with rewards and recognition, economic incentives. On trial level, there is a trial with complex trial design, do not recruit. Less well-funded, trials without dedicated trial management, trial with multidisciplinary input, trial with consumer involvement, trial that have a successful pilot phase, so trial that have dedicated paid local coordinators, cancer trials which are recruiting better than non-cancers, drug trials recruit better than non-drug trials, etc. Also, delays in ethical clearance, and so many others. Then, Other authors also grouping the barriers to recruitment and retention to two groups. This clinicians-based and patient-based. They are mostly similar to listed above, but anyway, short listing. Time from the clinician base, time constraints, lack of staff and training, worry about the impact on doctor-patient relationship, concerns for patients, loss of professional autonomy, difficulty with consent procedure, lack of rewards and recognition, and from the patient's perspective, additional procedure, additional travel problems, patient preferences, worry about uncertainty of treatment trials, patient concerns about information consent, protocol causing problem with recruitment, and clinicians' concerns. Also, factor could be a facilitator, and this is presented below. Definitely, mostly of authors is found that if site has a motivational people, motivational investigators, is that recruitment is going very smoothly. So, on the clinical team factor, important, interesting research question, topic important. Urgent need for research, good design, good protocol, pragmatic study. Clinicians keen to recruit to trial. Drugs already tested, so easy to explain to patients. Did not demand extra effort from patients. Impact on practice running and cost minimized. No competing trials for the centers. Drugs not available outside the trial. Good planning and organizational by clinical trial support unit, good public relation, good trial team worked hard at how to explain the study to patients. So other authors mostly considering the trial level, the study design, single or multi-center intervention, not funding source, novel trial design, recruiter differences, financial incentives for patient participants, and methods of providing information. So there is clear that factors could be barriers and could be facilitators. And this is recruitment and retention. Moment. And also, it is clear that barriers much more than facilitators. Also, authors very frequently, in order to predict the enrollment, quite frequently using the term predictors, applying to the factors and barriers. Authors used 59 predictors of sites which were at the end of recruitment is met their predicted enrollment goal, mentioned before start the recruitment in the feasibility questionnaire. And 59 candidate predictors was categorized into 7 categories. General center characteristics, staff availability, clinical trial experience, patient pool characteristics, potential perceived enrollment challenges, recruitment plan and strategies, and contract execution and protocol approval. So again, many items listed in this with regard to that categorization. Anyway, this is somehow could help to predict the enrollment. Important if it will be used at the end. So thus, there is no single approach to the classification of factors as well as in the terminology. The authors also know that the factors influence in different directions, and so shortly discussed, it is clearly shown that factors could be barriers if they decrease the recruitment and fail retention, facilitators if they improve these processes, predictors by the future perspective of success of trials, and could be a factors itself. Definitely, the qualitative description of the factors depends on the aim of publication of particular authors and not limited by the presented factors above. Some authors single out the influence of factors on the site, outside the site, macro and micro influence of factors, and the effect of some factors throughout the recruitment of patients, at a certain period of recruitment. Other authors distinguish between passive patient recruitment and active patient recruitment, while another proposed automation of patient recruitment and screening. And of course, factors affecting patient recruitment attract the attention of authors primarily in terms of success in recruiting patients and predicting success. But factors can also be parameters characterizing sites. And such ambiguity of factors influence the proposed numerous classification of factors. And it is not clear the basis for definition of terminology. It needs to be investigated in further edition. Thank you. This my short contacts. Sorry if too much new words, maybe new some wordings. Do you hear me? I couldn't hear you.
Very informative lecture. Thank you very much. It was a wonderful lecture. Any questions for Dr. Milovanov?
No, don't
any
worry.
Questions? No questions.
I'm also open for any question via any of my contacts.
Yes, you can contact him. There is all the information there. That you can also, there is the URL, and you can email and telephone number. Okay, thank you very much.
Thank you. Bye.